MSW and LSW. She has been working in the behavioral health professional as a senior psychotherapist. She is practicing in Pennsylvania, right? Okay. And is specialist in coaching and yeah, sorry. Yeah, she's specialist in coaching and treating patients suffering from mental disorders. She has been expert helping the families and the couples therapy and trained in trauma focused counseling. And about Satyajit sir, he is also MSW and LSW, licensed behavioral specialist. He has been working in behavioral health profession as senior mental health practitioner. He is certified in psychopharmacology and cognitive behavioral therapy. He is pursuing PhD in healthcare leadership in US University. I welcome both of you. We are ready to listen to you on the important topic, which is, I guess, really important for all the immigrants. Thank you. Over to you.
Yeah, you can share the presentation, Chitra. Satyajit. Yeah, we can see that.
Okay. Thank you for a very nice introduction. I really appreciate. So, today we are going to discuss about the couple of mental health disorders. And first of all, Jai Bhim and Namo Buddhaya to everybody. And thank you for providing this opportunity to discuss with you all. This is really significant topic that we hardly speak. So today we are not going to discuss so many disorders or mental health problems, but we'll discuss how a couple of mental health issues we deal with as being immigrant. So our presentation is that uh, being immigrant, how our mental health is in America or abroad, people who are living abroad. So many of us here, we are immigrant, come to this country looking for better life and more opportunities. Along the way, we face challenges like getting permanent legal status, H-1B visa approval, or green card approval. It takes time, and during that time, we deal with a lot of uncertainty. We lack the resources which can make our life tough. Immigrants often struggle with mental health challenges as they adjust to new country. We all adjust the new country actually. Even we travel to new city, we have to learn and unlearn a lot of things. So therefore, we got a very good tool that Baba Sahib adopted from the Buddha, and that is a Buddhism, and in Buddhism mindfulness, and along with that the contemporary therapeutic tools, especially the cognitive behavioral therapy, are very helpful tools to manage some of the challenges that we deal in everyday life. So in today's discussion, we will explore the mental health problems, how it uh, affect us, and how the mindfulness and cognitive behavioral therapy improve the well-being of individuals who are living who are living abroad. And we also wanted to see different kind of tools and techniques and the support system that would help people to uh, to deal with the challenges. So the concept of mental health, we need to understand what is the definition of the health actually. Health is, according to the World Health Organization, health is a complete, it's state of the complete physical, mental, and social well-being, and not merely absence of the disease. So it's not merely absence of the disease, but it's also complete, status of the physical, mental, and social well-being that's important for somebody's health or person's health. Uh, this definition was adopted in during the 1946. The World Health Organization organized the conference in New York, In 1998, two proposals were made to change the definition and bring the spirituality as a part of the health. I think that spirituality did not included in the definition of the health, but still it's very important component to look into because your health is not complete without your spiritual understanding, without your spiritual well-being. That's why we can see here the Anna making efforts to provide the spiritual connection to the not only the adults but to our next generation. And it was wonderful to see that and how our kids um, trying to understand Buddhism and the basic foundation of Buddhism, and their stories are really um, very insightful, educational, not only for the kids but for all of us too. So I wanted to say again thank you to Avnika, for her beautiful presentation and the kids' participation. So, so the concept in mental health, it's about what is mental health is about how we feel, and how we handle stress. It is not just about being free from the mental illness. It's about having the good state of mind that helps us to deal with life challenges, everyday challenges. We use our talents, learn, and work to contribute for our communities. So mental health is basically for individual well-being, but it also helps to the family and it also helps to the community. So therefore, mental health is very important component that I say that, and that's how the concept in mental health has been adopted and introduced by the World Health Organization in 1946. So what is a good mental health? Uh, Good mental health is help us to make a decision, the positive decision, the concrete decision, the decision that helps to bring the betterment for individual's life, family life, and the community at large. It helps to build the relationship. It shape our word. It shape our word. Our word could be the small word. Our family could be our word. Our Anna family could be our small word, and then the word around your neighbors. We talk about metta bhavana. So the word could be the coming from your small word to the your larger word. It's a basic right and essential for personal growth and overall well-being of communities and society. So this is very important for us, for all of us. uh, we'll discuss about mental health conditions. What are the mental health condition? So this includes various issues like mental disorders or emotional problems that can cause significant stress or make it hard to function in day-to-day life. Not every with mental health condition will feel the same way, and their experiences can vary. So my mental health problem could be different than somebody's mental health problems, but we do have the mental ability, and mental health is very important. Like we take care of our cold, our fever. It's the same thing. We have to take care of our mental health, and being Asian, being South Asian, we have a lot of taboos to talk about mental health, and that also lead to the lot of causes. And sometimes, people bottle up with the problems, and that problems could explode in different ways. So, so World Health Organization, they also have a different determinants for the mental health. Um, this is just, trying to understand, how is the mental health at world level, look upon. So there are multiple individual and social structural determinants, that combine to protect or undermine our mental health and shift our position on the mental health continuum. It's very important to understand that there are different factors we just discussed, and how we can uh, how can we utilize these determinants for our better mental health. So sometimes people living in unfavorable social, economic, geopolitical, and environmental circumstances, including poverty, violence, inequality, and environmental deprivation, also increase the people's risk explains the mental well-being. And they're having the mental health conditions. For instance, individual from so-called, we always talk about the caste system because that's our core concern. Uh, so people coming from the lower caste often faces systemic discrimination and social exclusions, which can lead to the chronic stress and increase vulnerability to the mental health issues. Uh, for example, the people in America uh, who are the victim of the slavery or the discrimination, especially the black communities. They have been struggling with their mental well-being for a long time, and they might have some genetic mental health disorders. They have some genetic health issues too, like people who work on the cotton farms. They have been dealing. Their next generation dealing with the back pain. Similarly, the people who gone through the different stress and trauma, they have the genetic post-traumatic stress disorder. Risks can manifest at all stages of life. Uh, those that occurs during the developmentally sensitive period, especially the early childhood development, are particularly detrimental. For example, children from oppressed caste may experience bullying and segregation in educational settings, leading to lower esteem and higher rates of anxiety and depression. So, caste system, we talk it's a very vicious, cycle. It's a very vicious virus that just not limited to the Indian subcontinents, but it also come to the American and some European continents, and it's been affecting the generations, and it could lead to the problems to our children, including having this low self-esteem, social anxiety, and depression. uh, if someone has strong emotional skills, uh, they uh, they might handle the stress in better way. However, if the struggle, if they have a different kind of struggle with, people have a different coping mechanism. Some people smoke cigarettes, some people drink alcohol, uh, or some people might have the family history. They might be more at risk to have the mental health problems. There are social and environmental factors. Living in poverty and experiencing violence can increase the chance of developing mental health disorders. Excuse me. For instance, the child growing up in violent neighborhood might feel more anxiety or depressed during due to the unsafe environment and living in the unsafe setting. So, for example, the kids living in the projects uh, in Detroit, in Philadelphia, or some of the New York's projects, they always have some kind of behavioral issues, not necessarily just only anxiety, but ADHD. Having the problem with lacking focus, having the problem of showing the better progress in their school. So these are the factors that can impact their growth. So, so today we wanted to just basically discuss about a couple of mental health disorders, especially the anxiety and depression disorder, and how we can explore it and how it is going to be how its prevalence among the H-1B visa holders or the people who are struggling with immigration problems. So I'll hand over to Chitra.
Satyajit, I just want to make sure we are only on the one slide. Are you moving any slides?
Yeah, you have a couple of slides.
Okay,
Oh,
okay.
are you able to see these slides or no?
We are only seeing the slide called fight or flight behavioral symptoms.
Five. Okay, so okay, are you able to see these slides? Slide?
No. Can you
No.
reshare it, unshare and reshare one more time because there was only one slide was showing up. Yeah, please.
Oh, okay, okay, okay. Sorry for that.
Thank you.
So escape.
Maybe
Mm. Manish sir, are you able to see this one or no?
oh, not yet.
Oh, okay, okay. Sorry
You are
for
not
that.
sharing
Actually,
anything.
yes.
Looks like right
Oh,
now.
okay.
Can you reshare?
Yes, yes, yes.
Please. Yeah.
I'm sharing the screen again.
Right.
Okay.
If you have two screen, then it gets. trouble.
Yes, yes. I think it is because of that. Uh, Pante, tinay na? We have to share this. Sorry for technical glitch.
No, no, no problem. We'll
Yeah.
wait.
Okay. Entire screen. Should I
Yeah, yeah,
share
yes.
it? Okay,
Yeah,
just
that will
once.
be better. Yeah, yeah. We still cannot see your screen.
Okay, just one sec. Okay,
Yeah.
sir. Sorry.
Yes, right now we can. Perfect.
You can see you can see our slide or not?
Now we can see the Ana Vihara thing, but the slide is not there.
No.
What now?
No.
Yeah. Yeah, you can stop that one and you can share the one that you used to share before.
Put a slide.
Yeah, if in worst case it's not showing up, that's fine also. It's not a problem. But you guys can continue. Chitra Satyajit, are you guys there? We completely lost you. Let me get back to that.
Yes, sir. We are here.
Oh,
Just
you guys are there. Okay, okay. We
yes,
completely
yes.
lost you. So
So, so I think Chitra will discuss about next. Uh,
Alrighty. So thank you everybody for giving us this opportunity. Mental health issues, which are majority our community, Indian. I mean to say, avoid talking or exploring more. So here we are. So Satyajit has given us idea that what mental health is, and especially when it comes to the immigrants like us, what impacts it has. Um, I'm going to talk about two major mental health disorders which people get affected throughout their life, going through so many other issues at individual level, family level, um, at job place, any kind of discrimination, etc. So let's talk about and get the understanding of anxiety disorder and its impact on everybody, especially as we decided for today's session to talk about immigrants and their mental health issues coming from their safe zone. Like we all have our country and family, when we get out of that safe zone, what happens? So here we're going to talk about anxiety. So, anxiety and depression disorders are significant mental health issues that affect many immigrants and H-1B visa holders. And we all have been through that more or less. Everyone's resilience is at different level, and they handle it differently. At the same time, your family background, your family support, and upbringing, everything also includes how you deal with the situations like that. So, impacting their well-being and daily lives by new place, new people, and again being away from family and safe zone, it adds into your anxiety or state of mind and depression. The pressure of adapting a new country, coupled with the uncertainties of visa status, job security, can contribute to heightened levels of anxiety. This presentation aims to explore the prevalence of anxiety and depression disorder among these groups and examine how their unique challenges and stressors influence their mental health. Understanding these factors is crucial for developing targeted support and interventions to improve the mental health well-being of immigrants and H-1B visa holders. So what are the symptoms of anxiety disorders? It's at different levels, like you will see physical symptoms, emotional symptoms, physiological symptoms, as well as behavioral symptoms. So anxiety can be influenced by different factors, as we discussed before, including biological, psychological, and environmental and biological factors. Let's look at them what they are. So genetics. If someone has family members with anxiety disorder, they might be more likely to experience anxiety themselves. For example, if parent has anxiety disorder, their child might also be more prone, because sometimes it's like a thin line, I would say, being a therapist for so long. It could be adapting factor too, that this is how they have seen people acting and reacting, who they trust and being around, so that's also there. As well as another factor we can say is that brain chemistry imbalance in brain chemicals like serotonin or dopamine can affect mood and anxiety levels. For instance, a person with low serotonin might feel more anxious. Medical conditions, certain health issues like thyroid problems, heart conditions can cause or worsen anxiety. Someone with thyroid disorder might experience increased anxiety as a symptom, as well as some chronic health issues people go through. That also adds into your. Oh, it's started.
Like
Okay, good.
my start.
Um, yeah. So that also adds into the anxiety because everything changes around you. Living style changes, the impact of your healthy lifestyle and everything changes, so that adds into your anxiety and how to deal with the health issues, etc. Psychological factors. Trauma. Experiencing a trauma event like accident or abuse can lead to anxiety. For example, someone who has been in a car crash might feel anxious about driving. Same with people with different trauma, and we can talk about caste or we can talk about race here. um, that also leads into people acting and behaving certain way, feeling comfortable or uncomfortable certain way, a certain situation or around people, or social anxiety. That's a better example we can have, that people don't like to be around people, many people, they feel suffocated if they are around couple of people, for example. Let's talk about personality trait. Which slide number? I am on number 9, Maishtata. So
Sorry.
yeah, that's fine. So stress, ongoing stress such as from work or personal life, that contribute to anxiety. Like someone wants it could be anything, like we all are professionals here, like we need some position and we don't get that and somebody else get it, and we have given our best to it and we didn't get that position, so that also adds into the stress level, and that affects anxiety. um, Another thing, being H-1B holders, getting that support from the workplace to continue our visa, or applying for green card, things like that, that's also adds into the anxiety. And people live in the stress, under stress for so long, that affects anxiety as well as that affects you physically too, which sometimes we miss. um, yeah, so for example, as I said that um, perfectionist personality traits, that could be like certain personality traits, like being a perfectionist who wants to be everything to be organized, everything to be on that particular track. If that moves, it affects them, you know um, the perfectionist might worry about excessively about making mistakes. That is also there. Environmental factors like life event, major changes like moving to new city, losing a job can trigger anxiety. For example, someone who has just moved to new country might feel anxious and adjustment to a new culture and environment, and that could lead to adapt them to act certain way, or finding new norms than what they were doing before, and that then clashes between couple, parents with their kids, that why my kid are acting certain way, he was or she was not like this before, you know things like that, because it's a pressure to be the best or be like everybody who's around you, that so-called norms. um, Social influence, social factors such as peer pressure, I just mentioned. So people also, like, social drinking sometimes starts like that too, because oh, it's a norm, so that also is under people being under pressure go through it. All right, so in summary, anxiety can be shaped by mixed biological factors, past experiences, current life circumstances. Understanding this can help finding ways to manage and treat the anxiety. So, accepting is the most important thing, that okay, I'm going through something like this and it's okay, because there is a help outside we can get. So now I'm going on anxiety disorder among immigrants and H-1B visa holders. So high levels of anxiety among H-1B visa holders, particularly from those are from South Asia. Uncertainty about visa status, long waiting times for green cards, work pressure, cultural adjustment, that adds into it. Let's go through this case study. RJ or Raj, an Indian software engineer on H-1B visa. His symptoms are chronic worry about job security, fear of deportation, difficulty sleeping. Impact could be strained relationship with family, decreased productivity at work, could be at home too. Um, Coping mechanism he is adapting could be drinking alcohol, different kind of drugs, or smoking cigarettes, or mood altering chemical substances, or isolating himself. What could be the positive coping mechanism? Finding the support groups, mindfulness practices, legal assistance for his um, visa status or situation. Alrighty, so impact on mental health. It could be short term, it could be long term. Under short term comes increased stress, decrease quality of life. Long term could be higher risk of chronic mental health issues, potential for depression, and drinking issues or substance issues. So let's look at the second case study, Priya's journey. Priya's background is she's a South Asian immigrant awaiting her green card. Um, Symptoms are overwhelming, anxiety about her family's future, difficulty focusing at work. What are the impact? Unable to make any decisions at work, at home, family level, individual level, um, and so on. Miss deadlines at workplace, have social withdrawals, things like that. Means don't want to involve in anything, just isolate herself and just keep thinking about the situation or the problem. What could be the support system she can use is like getting into the therapy, individual therapy, engagement in cultural activities, connecting with other immigrant communities or people, things like that. That could help to deal with the situation in a way, and find solutions too. So let's look at the addressing anxiety in immigrants. What are the support system, employers' role, government policies, etc. And what could be the coping strategies for anxiety and resources and support? Coping strategies could be self care, therapeutic approaches like CBT, cognitive behavioral therapy, that's what it means. Mindfulness, relaxation techniques comes like meditation, going for walks, talking to other people, etc. Community support could be joining support groups, seeking help from cultural associations. Like for example, like we enjoyed the ANA's program in month of May. that could be a solution, or could be like, out
Support.
support group, but as well as, let go of certain things, like there are other people like us, that feeling, that assurance you get by involving in groups like that, and listening to the stories, of course, from others, that what they have done, what they've been through, etc. um, Again, this is what we can do it, as well as there are resources and support here in USA, like National Alliance for Mental Health, Anxiety and Depression Association of America. Online services are there for mental health. Apps are there. Different forms for H-1B visa holders are there. Professional help, like therapists are there. You can, through your insurance, you can approach, find out what kind of places you can go, outpatient programs, you know and it could help in the mental health issues, or legal advisor, that also helps, to deal with situations like that, or minimize your stressor and level of anxiety, finding the right information. Okay, call for action, I'm sorry. Encourage seeking help, supporting peers, and advocating for better mental health resources is very, very important. It's okay to talk to somebody who you feel like you can trust, and let them know, because sometimes, it's not always that you need solution from others by telling them what you're going through, but when you talk about it, and that also you hear that, okay, this is what I'm struggling with, and taking out of something, which is bothering you for so long, that also mellows down the level of anxiety. So that is important. Utilizing community resources, mindfulness resources, those are available in person or virtual. Now, after this COVID, virtual is also there, so you don't have to go anywhere. You can just find that online in your community, um, and count in your county, by just simply calling your insurance company and asking them, this is what I'm looking for. They can help you to find it, and you can go ahead for that. So yeah, it's there. Now let's go ahead and understand depression disorder. What is depression disorder? A definition of depression disorder is a common but serious mood disorder characterized by persistent feeling and sadness and loss of interest. There are different types of depression, like major depression disorder, persistent depression disorder, bipolar, adjustment disorder, things like that, and so on. Um, what are the symptoms? Let's look at the symptoms of depression. Persistence, depression, hopelessness, irritability, feeling of guilt or worthlessness, loss of interest in activities once enjoyed. Physical symptoms: fatigue, changes in appetite or weight, sleep disturbances. Sometimes some people find difficulty falling asleep, staying asleep. So two different. Physical aches and pains, slowed speech or movement. These are the different symptoms of depression. So if you're finding something like that, it's okay to find a help. What are the cognitive symptoms? Difficulty concentrating, making decisions, or remembering things, suicidal thoughts, feeling hopelessness, helplessness at times. Sometimes people attempt suicide, so that's also another thing. Um, let's see what are the causes and risk factors. There are different causes: biological, psychological, environmental. Depression can be influenced by various factors, including, as I mentioned, biological, psychological, environmental. What are the biological factors? Genetics. If depression runs in a family, someone might be more likely to experience it. For example, if a parent or a sibling has depression, their relatives might also be at higher risk. Brain chemistry. Imbalance in brain chemicals like serotonin can contribute to depression. For instance, someone with low serotonin levels might feel persistent sadness and lack of interest in activities. Hormones. Changes in hormones, such as those during pregnancy or menopause, which we all know. more or less. Like postpartum depression can occur by after giving birth due to the hormonal changes. Psychological factors, trauma, experiencing traumatic events like abuse or violence. Domestic violence is a very easily finding, unfortunately, example we can give it. Like, and domestic violence is not only like physical abuse, but mental, emotional, sexual abuse that also comes in a domestic violence. And people, women, majority women and men go through domestic violence, do find themselves being depressed, etc. Major life changes, significant changes like losing a job or going through divorce can contribute to depression. Um, Stress, different levels of stress. Major life changes in that also comes grief. We'll talk about that later too. Stress, high level of stress from work, relationship, other sources can lead depression. For instance, person facing ongoing stress at work might develop symptoms of depression over time. Environmental factors, chronic illness, dealing with long-term health conditions like diabetes, arthritis can contribute to depression. There are again chronic health issues that's also kind of stirs up depression issues. Lack of social support, not having a strong support network can make depression worse. For example, someone who feels isolated and without friends or family to turn to might struggle more with depression. Financial issues, struggling with money problems can lead to feeling of hopelessness and depression. Overwhelmed and depressed feeling comes due to the financial hardships and debt, etc. In short, depression can result from a mix of genetic, hormonal, psychological, and environmental factors. Recognizing these factors can help in finding effective ways to manage and treat depression. Depression disorder among us, immigrants, and H-1B visa holders. Higher prevalence of depression among H-1B visa holders, particularly Indian South Asian immigrants, because we have a long list for the H-1B visa and the green card. So we all know how that is. Prolonged visa processing times, fear of losing legal status, job insecurities, cultural adjustment, separation from family, everything adds into it. Um, Again, impacts of depression on mental health could be short term, long term. Under short term comes increased stress, low productivity, strained relationships. In long terms comes chronic mental health issues, potential for substance abuse, suicidal tendencies. Let's look at this another case study, Samir's journey. Samir, a South Asian immigrant awaiting for his green card. The symptoms are deep sadness, hopelessness, frequent crying spells, withdrawal from social activities, missed work deadlines, that's the impact, frequent absenteeism, social isolation. What could be the support system for Samir? Is therapy, medication, con- connecting with support groups, H1B groups for the H1B visa holders, engaging in physical activities. Let's look at the second case study, Ria's experience. Ria is an Indian IT professional on H1B visa. Symptoms are persistent sadness, anxiety, loss of interest in work and social activities, chronic fatigue, insomnia, feel insomnia like sleeping issues, feeling of worthlessness, difficulty concentrating. What are the impacts? Difficulty performing at work, strained marital relationships, isolation from community. Coping mechanism, therapy, participation in cultural community events, legal consulting from visa issues, reaching out to the friends and families, or sometimes colleagues too. That also helps. Or your boss if he's good or she's good. Alrighty, so Going through that, there is one important thing what we all have experienced during the COVID, as we all were stuck with our loved ones, and sometimes to some other some the something like that. So what was the impact of COVID-19 was, it kind of created family disputes. During the COVID-19, the domestic violence issues were really high. Women and children were kind of more prone to be abused and not get reported because they had nowhere to go at that time. Um, so let's see what mental health issues people go through during this pandemic. The most important thing in that was isolation, as we have all experienced, as lack of social interactions due to the lockdowns, intensified feelings of loneliness and depression, separation from cultural and family support systems. Job uncertainty was there. So many people lost their job. There was no income for so many people from different level of class. Um, Fear of layoffs and reduced job opportunities highlighted anxiety levels. Prolonged visa processing times added to the stress too. As I mentioned, increased marital conflicts was there too, because sometimes in some families the jobs were like separated, and like, this is yours, this is mine, and that's all. Um, Coming together for 24 hours for so long continuously, that kind of created some kind of clashes within the couples and families. Um, Constant proximity. Couples spending more time together face increased conflicts over household responsibilities and parenting. Lack of personal space and privacy led to heightened tensions. I'm sorry. Work-life balance. Difficulty in separating work from personal life resulted in burnout and frustration. Stress from managing professional responsibilities and home duties um, simultaneously. Alrighty, so strategies for coping. Let's see what are the strategies for mental health support and coping mechanism we can use as professional help, access to virtual therapy sessions and counseling. Now it's in Philadelphia we have like in person too. So of course that's there. Utilization of mental health resources and support groups, self-care practices, incorporation of mindfulness and relaxation techniques, regular physical activity, and maintaining a healthy routine is very important. Like people with depression, it's very hard to just get up from the bed, and simple thing is like taking a shower, it becomes a task, you know. So keeping that routine and self hygiene and maintenance is very important. Improving marital relationship is important. Talking with each other, excuse me, giving each other a space and um, a place to express themselves. Effective communication, setting aside time to open and honest discussions and letting each other finish what they have to say. Seeking couples therapy to navigate conflicts. And it's okay. That doesn't mean that everything is falling apart. Before it falls apart, you seek for help. Excuse me. Share responsibility, equitability, dividing household takes, task and parenting duties, supporting each other's professional and personal growth. That also helps um, in dealing with anxiety or depression issues. Now let's look at the children. We all have kids. Along with it, some families, their kids born here in US. Some they have born back in India and they came along with their family. So, children of H1B holders often face unique stresses contributing to mental health issues. What is it? Let's look at it. Cultural identity struggles, balancing dual identities like heritage culture versus American culture, feeling different or excluded due to the cultural background. Academic pressures, high expectations from parents to excel academically, pressure to pursue prestigious careers, parental anxiety and stress, parents' uncertainty regarding visa status and future stability, transference of parental stress and anxiety to children, promoting healthy communication and emotional support within families. I will just give you one example. It's not exactly what I just mentioned here. However, when we were in the training and looking at the children's trauma and depression and things like that, or behavioral issues, for example, so there was a case study was given to us, which is a real case happened in here USA. Again, this is little different than what we just mentioned here, but I just wanted to give you an idea that how uh, trauma kind of percolates to the kids, even though we think that, oh, they are in different room. So there was a family set of five, mom, dad, three kids. Kids age was, let's say, like 12, 8, something like that, and the youngest was the baby in a crib, you know um, and the father had alcohol issues, and after coming from work, he used to find any reason or anything could provoke him to hit wife, and that's what he used to do, which has impacted his kids. The study find out later on, when the kids were taken away from the family and the mother was also helped. The thing was, the 12 and 8-year-old could talk and tell what is it, what trauma they have been through and how it has impacted. But the most impacted child was the baby who was in a crib. Even though baby never seen mother being hit but heard everything, was the most impacted child they found. So even though we think that, oh, we don't talk to our kids about our stressors, or we don't tell them or share or show them, but they do see what's going on. So yeah, that's why we have to think about and be more alert about children's mental health issues too. Alrighty, so what are the social challenges? Language barriers, difficulty in communicating, forming friendship, feeling isolated in school settings. Kids who came from India or different countries to states, United States, the language barrier could be there, but sometimes, especially our kids, they could speak English, but the accent. So they're trying to adapt and trying to build that relationship which they have lost back in India and creating new here. So they're trying to adapt and act like their peer group. As a parent, finding that and normalizing it for them and talking to them, having positive communication is very important. Bullying and discrimination, racial and cultural discrimination, bullying related to ethnic background is there. So yeah, like yesterday, one of my client, 17-year-old, just shared a incident with me that he was going to Islamic school, which his parents now decided to take him out. And he and his another fellow friend was there. They are from African American background. Even though this Islamic school doesn't have all white family background kids, but they were abused, or they were like racially discriminated, that, oh, you guys supposed to be a slave of the school. That was a statement of another fellow student. So yeah, people do go through, even though they have same religious background, etc. Cultural sensitivity and training, that could be a strategy or support programs in schools to foster inclusively and understanding the background and where people coming from, etc. Encouraging diversity and cultural awareness is important. Mental health resources, again, accessible counseling and therapy tailored for immigrant families, approaching and taking that help is important. Support groups for parents and children, that also another resource for mental health issues to deal with. Parental involvement, educating parents on recognizing signs of anxiety and depression is important. Um, Alrighty, so WHO has given a comprehensive mental health action plan, which Satyajit is the one who will talk about it. So I will hand over to Satyajit.
Thank you, Chitra. Actually, you explained very well. Actually, World Health Organization, they had made a plan during 2013 and 2033. So you can find a lot of resources on World Health Organization .org or WHO.org. So since we have limited time right now, so I would request Mahida, can you go on the slide 33? So we'll just discuss the area that is more concern to us actually. So. So, like as Chitra explained, and most of us know about anxiety and depression. It's very prevalent among the immigrant, but more than it's prevalent throughout the world. Actually, the depression cases, according to World Health Organization data, it says almost 280, approximately 280 million people are suffering with the depression, and more than men, women's are, and the people over the 60-year-old, they suffer with the depression problem. Almost 300 million people across the world suffer with the anxiety disorder. So how we can combat this kind of depression, anxiety, especially people who are living here in America, and having the problem of immigration, and having the better life, when they're looking forward for their green card and the citizenship. So this problem actually of depression, anxiety doesn't reduced, or doesn't go away even you get your green card or your citizenship, because it's follow you. uh, because this says the mental health disorder, it cannot be cured, but it can be managed. So it's like a diabetes. Diabetes sometimes it cannot be cured, but it can be managed. So same thing like high blood pressure. We have to manage our high blood pressure when we diagnose with. So same thing. We have a very good tools and techniques that has been provided by Lord Buddha. And we're thankful to Dr. Babasaheb Ambedkar because he introduced to us. So everyday mindfulness meditation, while we were attending online Vihara, and closing your eyes and doing the mindful meditation, that helps to stay present. What is the depression is, or anxiety is, anxiety is like we constantly worry about future, and meditation teaches to stay in the present, stay away from the negative thinking patterns or negative thinking channels, and restructure your thought process. So daily mindfulness meditation session manage your anxiety and help you to stay grounded. Regular metta bhavana, we always talk about the love to ourselves, love to our family, love to our neighbor, love to the world. We always talk about the love and compassion. So that's very important for all of us. Then we also need to follow our noble eightfold path, and that also help us to encourage our ethical living and mental discipline and wisdom. uh, Adopting aspect of this eightfold path, uh, such as the right mindfulness and right efforts, it's increase our balanced life and improve our mental well-being. So I would request people who are not who are attending today's Vihara to continue with this, but also encourage our friends and family members to continue follow the meditation, mindfulness meditation, and the path of the Buddha, and everyday practice following Buddhist rituals. It's very essential for our mental well-being. Uh, Next, Dada. Yeah. So um, the contemporary science, they teach us how to manage your different mental health disorders. So cognitive behavior therapy, which was introduced by Aaron Beck. uh, he was a psychiatrist in actually he practiced in Philadelphia. I was so lucky. He lived almost 100 years, and I was so lucky to, attend his some of the session. And I'm certified in his institute, Beck Institute of Cognitive Behavioral Therapy. So this therapeutic approach, it helps. Uh, it's like similar to the mindfulness, but they give the different names, scientific name for therapeutic approach. So it helps to identify our thought process. Your, they identify your challenging negative thoughts patterns, recognize and rephrasing our irrational fears about certain situations. So it may be for visa or job insecurity. So it helps us to understand how we can restructure our thought. Then it also talk about relaxation techniques, but like we have the mindfulness that also help us to relax in ourselves. But there could be different relaxation techniques. People, going out, having a different kind of, fishing, doing exercise, just attending or on a retreat, or we in tri-state region we used to meet every Purnima day. So this help us to disqualify the negative thoughts and restructure your thinking, and think about the positive, because mindfulness and CBT, it helps us to think in present, think in positivity, and change the negative thoughts. So we always teach our patients about three C's: uh, catch your thought, change your thought, and challenge your thought. So this coming from the CBT. The next, Majda. So take away from today's sessions, actually, it's we have to work on the STOP sometimes. That means we have to stop negative thoughts, and work on your positive, affirmative actions. Actions help us to have the affirmative decisions, and affirmative decision help us to have the better mental well-being. So resilience building, combine of the mindfulness and CBT foster emotional resilience. Uh, Applications could be developing skills to cope up with future challenges and uncertainties such as career change or family transitions. Enhance quality life, it's improved mental health, leads to better personal and professional relationship. Maintaining practice that promotes mental being, encourage fulfilling of post green card approval too. So it's like I said, it's not only for the the present struggle of your immigration problems, but it also helps us to transition from being the person who's seeking the green card, but who just got the green card and then looking forward to get the citizenship, or I should not get the citizenship. So it helps in that transitional process. And supporting the supportive community building, actually right now we all are meeting on online Vihara. This is also one of the support network that help us. And also I thanks to the our leaders, our main leader Dr. Baba Sahib Ambedkar, and the other leaders who wanted to stay as connected, not only in person, but like using the new technology and new forums like a Zoom or Google uh, Google links. We try to stay connected, and that help us to maintain our mental well-being. And the everyday integration of the with these practices, it helps. It's provide the valuable tools of managing our day-to-day stresses. And we have to encourage each other, actually, we have to encourage to nurturing this kind of environment to have the better family life. It helps for our children, it helps to our family, it helps to our community, and it helps to bring the social well-being. That's all from our end. Thank you.